Hello, JMIR followers. This is Dr. Jennifer Joe, JMIR Ambassador. Today, I'm delighted to be interviewing John Patiña, the Program Director of Brown Lifespan Center for Digital Health, on his recent publication in our Journal of Medical Internet Research. His recent review is titled Recent Academic Research on Clinically Relevant Digital Measures, a Systematic Review. John, welcome.
Thank you so much for having me. It's a pleasure to be here.
Congratulations on your research, with this being the first systematic review to characterize the nature of academic research on digital clinical measures, types of sensors used, and the funding sources. First, can you tell us more about the Digital Medicine Society, or DIME, its role in bringing together a multi-stakeholder group of experts that worked on the paper, and your role within it?
Yes, absolutely. So the Digital Medicine Society, their goal is to really build a shared foundation for digital clinical measures across research, healthcare, and public health. They really want to build this shared language across the different industries that work within the digital health space. They brought together a collaborative of experts across digital health to work on what's called the playbook, which is the essential industry guide on how to develop and deploy digital clinical measures in the industry space. An academia team was formed to investigate the nature of academic research as it pertains to digital clinical measures. And I represent the Brown Lifespan Center for Digital Health. We are dual affiliated with Brown University and Lifespan Healthcare Systems, which is the largest hospital system based in Rhode Island. And my role was to really provide the very unique perspective coming from an academic medical center. So at the Center for Digital Health, we have experts on the research side coming from the university and experts on the implementation and deployment of digital health tools on the hospital side, and really serving the community that we want to serve. I want to highlight here my colleagues on the academia team who are the real drivers and real writers in this systematic review. It truly was a collaboration, and I'm very thankful for that teamwork.
We at JMIR are very excited by the work and what you're doing, and also our partnership with you. This paper looks at digital clinical measures. To orient our followers, digital clinical measures are digitally collected health data captured by sensors. This includes information like your smartphone, being able to capture physical activity, and your smartwatch, being able to capture electrical signals from your heart to detect abnormal rhythm. This paper was the first systematic review looking at the nature of academic research on digital clinical measures. Can you talk to why this research was so important for us to do right now?
Absolutely. So this research is important because it identifies critical gaps, and I like to reframe this as opportunities in academic research related to digital clinical measures, particularly when the adoption of digital health continues to soar. During the COVID-19 pandemic, it was very clear that a lot of medicine, a lot of research had to shift over to remote, and the use of technology to gather information. In an age where technology is ever growing, ever evolving, there is really no limit to the imagination, the innovation of what digital clinical measures can do. This systematic review, though, really highlighted that there are these gaps, these opportunities in research, and there's a call to action to address these. And to really highlight that academic research, our role is so critical in this rapidly developing field, to make sure that digital tools that are put out there are worthy of our trust. In the digital health landscape, you have industry partners and you have the private sector, you have academic partners. Academia is really here to do research and to show that what we're putting out there, what we're creating, what we're innovating is valid, is safe. It adheres to the the ethics that many of us hold our work to.
The results and discussion points are so robust that I want us to move into talking directly about that. Our followers can review the study design by reading the paper. Specifically, figure 4 does a great job of highlighting these points. You call out that verification, analytical validation, and clinical validation studies are together the most frequently published study type. This is important and as expected, given that these are foundational to establishing whether a digital clinical measure is fit for purpose. You call out concern around the paucity of published studies examining the security, data rights and governance, ethics standards, and economic feasibility. Can you talk more about your findings and why this is concerning?
Yeah, so the findings that the top funded research around validation verification, it wasn't surprising, right? That of course, what we want to make sure that the digital tools that we are using are actually measuring what we needed to measure. The concern is really around what are we not researching in a time where we give so much of our personal information through technology, and it's not just giving our full name and our date of birth, but now with digital clinical measures, it's providing our heart rate, our movement. For behavioral health related digital tools, it's how we're feeling throughout the day. And the question, if you kind of boil down the concerns, it's around, well, what are you doing with my data? Technology and innovation is ever growing, which is wonderful, but at the same time, this is an opportunity to take a step back and really ask ourselves, what risks are associated with us giving this information through digital clinical measures? What measures are being put into place to secure that information? And there are very few studies that even look at that. And I think this is an opportunity to reframe a research question. When academic research, right now, academic research is around, again, that validation, that verification, but why aren't we asking the question around, is this ethical? Is this safe? I also want to highlight here the view around health equity. And I do know that that is quite an important value for the Digital Medicine Society, as well as the Brown Lifespan Center for Digital Health. Are we providing these digital health tools to the communities that we actually want to serve and help? There is this growing field of, what not only what is someone's health literacy, but what is their technology literacy? And making sure that these digital clinical measures and these tools that researchers and industry are trying to build really do have the consumer, the patient, the community member in mind.
You highlight that the number of publications reporting measure identification is relatively low compared to research into the development and deployment of these same measures. What is measure identification, and why are you concerned that the research in this area is sparse?
So measure identification is trying to identify the key variables, the key factors from the information that is extracted or pulled from those digital sensors to support decision-making. So with the comparatively low amount of studies on this, the concern is around, are these measures clinically relevant? Are they grounded in aspects of health that both the clinician or healthcare provider, as well as the consumer or patient, is it the actual measure that they care most about?
And are there other key findings that you'd like to discuss?
Yeah, I'd really like to highlight that most of the funding comes from federal resources. So that is the National Institutes of Health, National Science Foundation, Department of Defense, et cetera. And there is this opportunity for industry partners, for foundations to provide funding. At the Brown Lifespan Center for Digital Health, one of our key strategic areas is partnership development with the private sector to really collaborate at this intersection of where can technology companies, where can industry, where can big pharma really support academia. And one way is through funding. There is a lot of support and movement out there that the private sector or industries, they just want to push out tools and push out their products, which is a wonderful endeavor, but there is this opportunity now to say, let's provide funding for researchers, for clinicians, for folks that really want to explore security and ethics. And I think that would really set them apart in a wonderful way to really show that their commitment to digital clinical measures and to the support of the digital health field.
It's important for us to have an integrated and coordinated effort across academia, academic partners, and academic funders to establish the field of digital clinical measures as an evidence-based field worthy of our trust, as you've mentioned before. Your research underscores that some specific sub-areas of academic research related to digital clinical measures are not keeping pace with the rapid expansion and adoption of digital sensing products. Thank you to John Patena for your important work. You can read the entire paper, Recent Academic Research on Clinically Relevant Digital Measures, a Systematic Review, on the Journal of Medical Internet Research website, jmirpublications.com. As a reminder, we are open access, which means that the entire paper with all the figures and data is free and available to all. As always, be sure to follow us on Twitter, Facebook, and Instagram.